Hi, I'm Sandy Mon, the CEO of Droste Counseling Center. We partner with Kavod to provide mental health counseling services to residents, such as individual and group counseling services, using our model of training the next generation of mental health therapists. We work with area universities and engage interns and postgraduate fellows in this work alongside licensed behavioral health clinicians. In addition to individual and group counseling, we've also facilitated crisis support and a book group and engaged residents via animal-assisted therapy. Our partnership with Kavod came about maybe around 2016. One of our longtime therapists used to provide consultation to some of the social workers at Kavod, and over time, the need for more dedicated services to residents became clear. Our agency at that time was expanding our model of co-location. We had traditionally been serving in schools throughout the community, and we wanted to expand that to other places where people live and receive care. Beginning to serve residents at Kavod by providing services on site where people are already living, sometimes in their apartments or in public spaces throughout Kavod, in this larger way just made a lot of sense. It met our mission of reducing barriers to mental health care, as many Kavod residents are limited by mobility, transportation, cost, stigma. And I think it was particularly important we had this established partnership to support residents' mental health during the intense political climate and pandemic that we have all experienced these last few years. In the last year, we served roughly 40 Kavod residents, several continuing on each year. We've heard things from some of our clients that we've served saying, I leave feeling stronger each session, or I feel like my therapist really cares about my well-being. In addition to individual counseling sessions, we're also continuing with a book group to reduce stigma related to mental health care, and have provided Kavod with a Russian-speaking counselor due to the high population of Russian-speaking residents. We'll also be expanding our reach with Cora, the therapy dog, and providing meet and greets with animal-assisted therapy. Our partnership with Kavod has been a wonderful collaboration in both directions and a lot of learning along the way. And we look forward to continuing to foster a strong partnership that allows us to meet the needs of Kavod residents in a culturally responsive way and support the staff that are doing this direct work. Thank you so much.
My name is Sarah. I am an occupational therapist with Legacy Healthcare Services, and we have been working at Kavod for over 10 years now. We provide occupational therapy, physical therapy, and speech therapy services to the residents here. We contract out our space on the top of the 14th floor. We have this beautiful gym with a great view. We also have a private room for private treatments if needed, which is a great space for some residents. And we also are able to provide services in residents' apartments if they prefer to do so, or for whatever reason can't make it to the gym. So we also utilize a lot of space around the building. Kavod has a great partnership with us, and we are very appreciative for them having us work here for so long. They are so supportive of our services and what we're allowed to do and what we can do for the residents here. We essentially want all of the residents to remain safe and independent, to remain in their apartments here. And over the years, we've seen hundreds of patients through Kavod. We have consistently 5 therapists here, and we also have people come in if we need more help or if we're busier. So it's really nice to be able to provide our services here, and again, to have such a great partnership and relationship with Kavod. We're very grateful to be able to work with as many people as we can, and ultimately to keep them safe and independent.
So I am a clinical nurse supervisor for the CU Geriatric Clinic, and then I also oversee the CU Internal Medicine Clinic in Cherry Creek as well. Yeah. CU Medicine partnered with Kavod Senior Living several years ago to provide on-site primary care at Kavod Senior Life to both residents and community patients. CU Medicine is really aiming to increase primary care access for all patients in the community, especially those over the age of 75 that have difficulty transporting to UC Health Anschutz Medical Campus in Aurora, with an emphasis too of really trying to provide care to the residents at Kavod Senior Life as well. Yeah. Well, overall, we've seen over 250 patients in the clinic. And over 30% of those patients have been residents of Kavod Senior Life. So I think that kind of speaks for itself that we're able to really target these patients who have the most challenging transportation and access issues just due to their living status and also their insurance types as well. We've had an overwhelming positive response from not only the residents, but also the patients. And it's also been great to partner with the Health and Wellness Department at Kavod Senior Life to have these open channels of communication to help patients just navigate some of the most challenging barriers to care, such as home care services and specialty care referrals. Yeah, we recently expanded to having a clinic a full day on Mondays. That went into effect in April of this year, 2022. And we do anticipate on expanding more half days in the coming years, and also hopefully bringing in an additional provider to help take on new patients as well.